Hi, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where you ask questions about getting into dental school, getting into residency, life as a dentist in the U.S., even if you're an internationally trained dentist. And actually, that's today's episode. Today's episode, you're going to learn a little bit more about how to become a dentist in the U.S. once and since you have done your training on the other side of the U.S., maybe internationally. So today we have Dr. Navneet, I said it right, Dr. Navneet from India, who is actually in the U.S. now. And she contacted me. And Dr. Navneet, could you go ahead and introduce yourself and tell us a little bit about yourself?
Hello, Dr. Darwin. My name is Dr. Navneet, and I did my graduation from India in 2013. And then I did master's in periodontology, and I graduated last year, August 2017. And then I got married and came to US. Then I gave my part 1 in August, and now I'm preparing for part 2.
Good. So you're here in the US now. And are you thinking about going back to India not anytime soon, or are you staying here for a while?
No, I'm staying here.
Good. So sounds like to stay here, you want to do some dentistry, huh?
Right.
So what's your question? How can I help you? What's the dilemma or the issue that you're trying to solve?
Right. So my question to you is because I have done periodontology, right? Masters, I have already done masters in periodontology. So I really want to ask you that, is there any way I can continue study in my field and I can practice in US?
Probably the only way that you're going to be able to practice in the US is as a resident, maybe. For the most part, the main and only pathway is you've got to get licensed. To get licensed in the U.S., you have to have had training from a U.S. accredited dental school.
Right.
Now the advantage that you kind of have is an advantage and disadvantage, right? It's a disadvantage in the sense you've done 4 or maybe even 6 years of training in another country, and you have to do more time in the U.S. But the advantage is there are several programs throughout the country where you can just do 2 years, not 4, but just do 2 years and satisfy that requirement, and then potentially take a licensing board in one of the states, pass it, and apply for a license.
Right. So I was searching for a few postdoctoral programs, and I just emailed in UCSF and many other universities. They said that I'm eligible for this postdoctoral courses, like in the field of periodontology or oral surgery or whatever it is. So I'm eligible for that. So, but my question to you is, when I called to California Dental Board, and they said, if you do these postdoctoral courses, so even then also you are not allowed to work outside the university. You can only work in the universities. So is there, my main concern is this: I really want to practice outside the universities also. So even if I do the residency or residency in periodontology or postdoctoral programs, so will I be able to work or allowed to work?
You got the information directly from the state dental board. In order to practice dentistry outside of the university on patients outside of that environment, you have to have a license that's issued by the state of California.
Right.
And it's pretty much the same thing in other states as well. You can do the postgraduate courses, and I think you're talking about maybe it could be continuation courses, but it also could be training, right? Postgraduate training. But when you sit for that board, or when you apply for your license, you're going to have to fill out a very long application. You know, most of these applications, one of the things that they're asking for is documentation that shows that you've either graduated from a Canadian or U.S. dental school. So I have a lot of mentees and people that I coach that are like yourself, that actually go to Canada, right? or maybe have trained in India or trained in Brazil or trained in other parts of the world, and migrate and go to Canada, do dental school there, whether it's 4 years, 2 years, or what have you, and then maybe even apply and do a residency in the U.S., right? Get additional training or get that part of that additional training, and then they're able to apply for a license in the U.S. So again, most of the dental boards, and you have to go specifically to each state because each state has different requirements, right? But most of them, the one thing that they have similar across the entire board is they want documentation from a U.S. or Canadian accredited, CODA accredited institution. So that's the disadvantage in the sense that you've got to go back to dental school. But I will tell you, there are many programs. Actually, where you are, you mentioned UCSF, UCLA has an international program. USC has a program right there in downtown Los Angeles. I'm not sure about Loma Linda, which is another one that's a little bit south of LA. And then there's another new dental school called Western University's Health Science. Western University, Health Science University, which is south, like you're going towards San Diego. There's also a couple schools maybe in Arizona that you may want to consider. AT Still in Arizona, and then also in Nevada, Las Vegas, UNLV. I'm not sure if they have a international program as part of their pre-doc program, but they're close, and that's why I'm mentioning those schools. They're kind of close to where you are now. Where are you in California?
I'm in Sacramento.
Sacramento. So yeah, so UCSF. Maybe even the University of Pacific. I'm not sure if they have a international program, but all those schools that I mentioned have inquiries all the time from dentists, international dentists like yourself. So those are the schools that I would target on, so that you don't have to necessarily relocate so far, especially if your spouse is in the area. If you were going to expand and try to, cast a larger net throughout the whole country, throughout the United States, there are a lot of programs on the East Coast, University of Pennsylvania, NYU. I'm thinking Nova Southeastern. Tufts have a lot of residents that have gone through the Tufts University 2-year international program, BU as well. So those are some other options on the East Coast, but sounds like you want to stay on the left side, on the West Coast where you are.
Yes, I was looking for a few options in Michigan University, postdoctoral programs in perio also, and California Dental Board. When I called them, they said that for me it will be obligation to work in the East Coast for 5 years. And if I do so, and then I come back to the California, then I'll be allowed to work. Or I have to practice for 2 years in the rural state, any rural state, and then I can practice.
That's right. That's another pathway of getting a license. As long as you have a license in the state, in a particular state, most other states will recognize it. And if you had it for 5 years, without any issues with it, they will allow you to apply to their state through a process called license by credentials.
Right.
But you still got to get a license in one state though.
Right. So for me, like the best path will be to go for general dentistry first, for 2 years international program, and then a residency in periodontology or whatever field I want to go in.
That's right. And again, I have a lot I have a resident right now that graduated from a school in India, actually did the program at UCLA. She did it was a program specifically for internationally trained dentists where they had a chance, they had a preview into one of the specialties, in her area that she was interested in was actually pediatric dentistry. And she was able to do this, it's like an internship, post-grad internship for international dentists. She loved it, loved it, loved it, so much to the point where she decided, you know what, I'm gonna go ahead and make sure that I can practice here in the US. She applied to several different schools. I think her husband at the time was relocating to the East Coast, and I think he got a job in the East Coast. So she was applying to schools on the East Coast. Tufts was one of the schools she got into. She did 2 years at Tufts, and now she's doing, so now she's got her US pre-doc qualification, her graduation, her certificate and everything. And now she's doing a 1-year GPR, and she's still thinking about doing pediatric dentistry. So she'll probably, after this GPR, apply again, maybe stay even a second year in general dentistry and apply to pediatric dentistry. And there you go. There you go. She's on her pathway. So as a periodontist from India, you can do the same thing. You can do the exact same thing. It's just a little bit more investment in time, and especially if you know definitely that you're going to be here in the U.S.
Right.
Yeah, yeah. So, and again, there's probably a lot more people than you think that are doing the same thing and have the same inquiry. So, like I said, you mentioned UCSF. I would try University of Pacific, UCLA, USC is down in Southern California, about 6-7 hours away. But it's worth to at least be able to have a couple of different schools to choose from and apply to for those programs as well.
Right. So I messaged UCSF also. I emailed them, and they said that I can apply for the postdoctoral courses. So if I am eligible for those courses, so,
courses. See, that's different than postdoctoral program.
okay.
So I'm not sure. You know, let's make sure that we that you look into the terminology. A course is totally different than a program. The postdoctoral program means that you're studying to be a specialist at that school for that particular U.S. specialty. A course, it could be just a seminar. It could be once a month. It could be just one course. So, yeah, you're eligible to take the course, but that course just gives you more of an overview into the specialty, but it doesn't give you the certificate or the training that's required to be notarized as a specialist in the U.S.
Right, right.
So that's the difference. That's the difference. So again, of course, it's totally different than the actual training or the actual program. So you just have to make sure you have that clarification. And it's probably might be a little bit confusing, but I'm sure they're probably talking about a particular course or maybe an externship, like I said, that like they have at UCLA.
Yes.
Yeah.
They have it.
So was that helpful a little bit?
Yes. Right.
So you got some homework now, huh? you got a couple other schools to look into.
Yes. Right. I'll check each one of them.
Okay. Good. Good. Hey, I'm glad we were able to connect face to face, and thanks for reaching out. You said you found me on YouTube, correct?
Right.
Oh, that's great. That's great. So, hey, if you guys are listening, if this has been helpful, make sure you write a comment down below and say, yes, this has been helpful. If you have any questions, you can always send them to me right here at newdentistcoach@gmail.com, newdentistcoach@gmail.com. Be sure to tune in if you like what you've heard, like our channel. Make sure you push and like the actual like button, and actually subscribes. I will be posting.
I've done that. Already done that.
Good. Be sure if you have some colleagues that are similar to you that have some questions or are thinking about doing the same thing. There's about 200 plus over 200 videos on situations and dilemmas like you're kind of faced with right now that are very helpful. At least people have given us some feedback and said that they've been helpful. So I'm so glad we connected. You guys that are listening and watching, make sure you check out the next video. It's going to be right over here. Okay. Hey, Dr. Navneet, thank you so much. Nice talking to you, and good luck. Keep me posted on how you're doing too.
Yeah. Thank you.
You're welcome. Bye.
Bye.